Thank you, Madam Deputy Speaker. I apologise. I did speak to Mr. Speaker before you arrived, but and can I also thank the honourable member opposite for giving me just a few minutes of her allocated time, and offer my sincere thanks for bringing what the Prime Minister has rightly described today as this very important issue before the House this evening. He correctly identified the SDSR review as an opportunity to get this right in the future, and I fully support him in that intention. Madam Deputy Speaker, the subject before us this evening refers to that great stain on this nation of ours that I mentioned when I first rose in this House. The way we look after our veterans' mental health in this country, putting aside some excellent individual practices and charitable work, I regret to say remains poor. Many of our young men and women who, by good training and fortune, walked away from battle without any physical scars, have been stricken in later years by an underlying sickness that can tear at the very core fabric of the strongest and the most enduring individual. Madam Deputy Speaker, I speak as a Conservative Member of Parliament. I work hard to support all the efforts of government to produce and implement the exciting and progressive agenda so clearly laid out by the Prime Minister a week ago. But on this issue, whilst it remains in its current state, I'm afraid I will not be silenced. I have no personal agenda to drive here. I've never myself had the misfortune to need to use one of our tremendous military charities. I will simply and forever be the soldier's voice in this debate, crafted from much time spent on operations with our young men and women, and now in my privileged position as a member of this House and attracting a great deal of correspondence on this issue, it is incumbent upon me to speak out, and I will do so. Mr. Speaker, I feel embarrassed at my fellow man sometimes that we stand here again tonight in 2015 in the seat of the world's most advanced democracy and talk yet again about the stigma of mental health. The stigma results from a basic lack of education and understanding about a human condition that affects 1 in 4 of us, and a condition as medically valid as a broken leg or a fractured arm. But because it occurs in our heads, its treatment has been historically subjected to an unacceptable social, political and financial disadvantage. That stigma ends in this Parliament, and I will not rest until it has. Of course.
I had the honour of chairing a disability employment session at TUC today, and there was a young man with autism who I thought came out with a fantastic phrase talking about mental health issues in the workplace, which is, there is no normal. We all have mental health. Sometimes it's good, sometimes it's not. And maybe instead of us thinking about a certain percentage have a problem, we all have different problems at different times, and that might make it easier for people to come forward.
Absolutely, and when we have more time, there are some specific projects about sort of bringing that into what is normal and looking at that process, and I think that's an important part of it. I could inevitably speak all night on this issue, but I won't. In preparations for tonight, though, I stayed up most of last night and read as much as I could of a couple of books I have on my desk in my office here in Westminster. One called Aftershock by Matthew Green, and another called The Battle Against Stigma by Mark Neville. I do think we've got better as a nation over the last few years. I would ask, however, that before any of us enter into some exercise of backslapping on how far we have come on mental health in this House, we all read those 2 books and reflect on both what we ask of our servicemen and women and how we look after them when they come back. Of course.
Thank you. Thank you, Madam Deputy Speaker. The issue in the North East is that large numbers of young men go to war on our behalf from the North East of England and come back to their homeland. But and I've raised this with the Minister in the past, the services are able to support them 20 years on now. A lot of them fought in Northern Ireland, have gone back to normal life and are really struggling, and there is just no support and for their families. And it is a particular crisis in my region because it is such a large part of the former military population.
Yeah. I think the incidence of mental health and the time lag between it is well publicised, and people are becoming more aware of it. But I think we have a long way to go on that, and we see that, I think, on a daily basis. Our British public has, in the latter part of the last decade, been the knights in shining armour, flying over the horizon and rescuing some of our most war-scarred individuals. They've given millions upon millions of pounds, donated time, effort, blood, sweat and tears to looking after our boys and girls. They are quite simply what makes Britain great, and what makes us, when we are away, be so proud and fight so hard for the country we love. Madam Deputy Speaker, similarly now, this government has for the first time been elected on a manifesto that explicitly stated a parity between mental and physical health, the first time in history that has occurred. Similarly, we now have waiting time target lists for mental health, again for the first time in history. This government gets it, and I'm proud to be a part of it, and I thank the Minister personally for his valiant efforts in this regard. But there is so much further to go to win what I would call part of an internal generational struggle of ours with veterans' care. Madam Deputy Speaker, finally tonight I wanted to guard against a misunderstanding of the problem. The vast majority of servicemen and women in this country make a stable and successful transition back to civilian life. They are cornerstone of our communities, directors of companies, nurses, doctors, shopkeepers, lawyers and manufacturers. But Mr Speaker, our job in this space is to look after the 10%, those who, through no fault of their own, find life a daily struggle. Those who, with a bit of bad luck, a couple of poor decisions, could be any one of us. And in particular tonight, that refers to those who have often given their best years in the service of this nation, but have found returning to a civilian life the hardest fight of all.
Would my honourable friend aware?
Absolutely.
Also, I feel we should always mention the families, because very often the actual families are really affected and we need support for them.
So let's now win this fight and take our place again as a country at the vanguard of contemporary veterans' care. In 5 years' time it will be too late. The momentum in the battle will be lost and we will simply be fighting fires. The politics of good intentions and at time tokenism is finished. We must get this right, and I look forward to it being priorities in the forthcoming SDSR.
Minister.
Mr. Burt.
Thank you, Madam Deputy Speaker. It's usually a standard line to say at the beginning of a debate like this that we congratulate the honourable member for raising the subject, but it really is, and this has been a very interesting 18 minutes. My only criticism of the Honourable Lady is that this should have been at least an hour and a half or maybe 3 hours somewhere else. But I suspect that might be so again. But could I genuinely congratulate the Honourable Lady for raising it and raising it at Prime Minister's question today? Could I, if she permits, both thank her for her service to the NHS and to those in difficulties, and her husband for his service to the country. I'm delighted to be joined by my honourable and gallant friend, the member for Milton Keynes, who has also seen active service, and we have just heard from the member for the gallant member for Plymouth Moorview, my honourable and gallant friend. And there are times when your minister feels very humble in that your collective experiences outrank mine very considerably. So I will do my best to respond to the debate. Because of the length of the initial speeches, I've got slightly less time, but that's all right, because I want to make some changes to what I wanted to say. What I'd like to do is set out a little bit of what the government is actually doing. I don't intend in doing that to in any way suggest that what has come forward up to now is not valid and relevant and very important and very challenging to the government. I think it would, however, be fair of me to put on record what's actually going on. But palpably, it's not enough. If the Honourable Lady with her experience needs more, if my honourable friend with his experience needs more, then quite clearly, whatever it is we're doing, good that it is and better than it was, is not yet meeting the demands and the needs. And from the comments of other colleagues, it's not meeting the demands of the House yet. So I think with my my honourable and gallant friend from the Ministry of Defence here, we have listened very carefully, and there will be more to be said. But let me put one or two things on record, if I may. The government is fully committed to continual improvement in the treatment of mental health conditions for veterans and the general public alike. We're rightly proud of the courage and dedication of our armed forces. For those who've been injured either physically or mentally, it is indeed our duty to ensure that they continue to receive the very best possible care. As members have already said, the vast majority of those leaving the armed forces do so fit and well, having benefited from their time in the forces. Members of the armed forces are not significantly more likely to develop mental health issues than other professions, but support and clinical care does need to be available and geared to the specific needs of those veterans. Armed Forces and Veterans mental health provision has vastly improved since the publication of the landmark report Fighting Fit in 2010, which was, of course, at the hand of my honourable friend, the member for South West Wiltshire. He recommended that there should be 30 mental health professionals across England to provide services to veterans. With 10 veterans mental health teams now in place across England, we now have significantly more than the 30 professionals recommended. In deference to the Honourable Lady's position from Scotland, let me say a little bit about Scotland's provision, if I may. Scotland is proud of its commitment to improving mental health, including for veterans and their families. Visibility and awareness of mental health issues has substantially risen in the nation over the last decade, and that I think echoes again something that my honourable friend said. There is greater awareness. There are long-standing campaigns against stigma. It's not gone as far as it needs to go. It is easier for people to talk now, but for some with very difficult conditions, those are easy words. It's still difficult for them. There is better public awareness of mental illness, suicide prevention and faster access to NHS services and other sources of help. Veterans and their families have unhindered access to all NHS services, enhanced by priority treatment where that applies. Evidence-based care and treatment is provided across community-based settings through support from primary care, with specialist or hospital inpatient services provided as appropriate. In partnership with NHS Scotland and Combat Stress, the Scottish Government recently renewed funding for the provision of specialist mental health services for veterans resident in Scotland at the Hollybush House Combat Stress Facility in Ayr. £1.22 million per year over 3 years to 2018 will fund a range of specialist clinical, rehabilitation, social and welfare support at the facility. Evidence-based treatment programmes include an intensive PTSD programme, transdiagnostic and stabilisation and anger management programmes. NHS Lothian secured £2.5 million Armed Forces Covenant LIBOR funding to support the commitment and established Veterans First Point Scotland to work with local partnerships to explore how the strengths of the Lothian service could be delivered in other localities. Over the last year, work has been taken forward in 10 health board areas across Scotland to assist each local area establish key partnerships, identify premises, plan requirements and recruit and select staff. This work continues with the service in Tayside now open and others to follow. I want to demonstrate that England too is recognising and trying to respond to the needs of veterans, and let me say a little bit about that. Before I do so, could I just say to my honourable friend, the member for Strangford, thank you for raising the issue in relation to the Republic. I don't know the answer to that. We'll find out, and I recognise the point that he makes. And underpinning all that I'm saying, the demand for more research, which the Honourable Lady mentioned, is certainly one which is recognised. There is some good research. King's Centre for Military Health Research has done some good work in identifying the categories of those who might be more at risk. Reservists, of course, and their particular issues came up, and the other groups of veterans, particularly those who have been back for some time, is identified. But there are ways of picking those up, and let me say a little bit more about that. NHS England spends £1.8 million a year on mental health services for veterans, including the 10 veterans mental health teams. Up to £18 million funding is in place to provide the Combat Stress 6-week intensive post-traumatic stress disorder programme for veterans, with an additional £2 million of LIBOR funding being provided to Combat Stress to help veterans with alcohol problems, as the Honourable Lady and my honourable friend both mentioned, a key indicator of problems. Help for Heroes has received £2 million of LIBOR funding for its hidden wounds work, offering low-level IAPT services to veterans, and subject to the spending review, a further £8.4 million will be provided over the coming 5 years to help the most vulnerable veterans who have mental health problems. Indeed, of course.
Minister, you mentioned the LIBOR funding, and that's something that I've been pursuing, obviously, where I can through the Defence Select Committee and otherwise. We have been seeking for some time to have some of that LIBOR funding available for Northern Ireland to provide a rehabilitation centre for the province and for the many people who have served and will continue to serve. None of that has been forthcoming to the province as yet. I just asked the Minister, not today to give me the answer, but perhaps look at it for me and come back to me. Thank you, Madam Deputy Speaker.
Thank you, Madam Deputy Speaker. My honourable and gallant friend says that there is money available in a bidding programme, and we'll write to the honourable gentleman and see what more can be done in relation to that. Two things I want to say as we run towards conclusion. Many of the servicemen affected will, of course, be treated by the NHS in the course of the ordinary NHS treatment. And the availability of greater treatment now, the availability of the so-called talking therapies, the IAPT programme, has been particularly successful. it's very important to make sure that the particular needs of veterans are catered for in this programme. But there's been work done there to try and make sure that this is done. The IAPS programme has been very successful, as my honourable friend said. For the first time, we've got standard waiting times and access targets. This will help veterans too. But particular items of support for veterans that I can mention, there's a... Well, I've only got a couple of minutes, but if the honourable gentleman must...
I'm very conscious of the time, and I'm grateful to the Minister. I've heard much talk about service personnel, and I completely agree, but there seems to be little discussion about the impact of service personnel's mental health issues on children. Given the SDSR is coming up, will there be some commitment to investigations, discussions with the Children's Commissioners of the United Kingdom of Great Britain and Northern Ireland, Scotland, Wales and Northern Ireland, and how they can inform that debate?
I note the honourable gentleman's remark. I can't say anything about the spending review, but I take the point. Of course, anything that affects the mental health of an individual with a family has an impact upon them. That's recognised, and I hope the veterans' work involves that. Could I just say a little bit more, because I've got something specifically on that. In terms of additional services, there is a 24-hour Veterans Mental Health helpline that receives over 800 calls a month. There's an online peer support wellbeing and counselling service called the Big White Wall. This provides support and services to armed forces, their families and veterans 24 hours a day all year round, including, as I said, families. Combat Stress, of course, that people are aware of, and Help for Heroes Hidden Wounds, a psychological wellbeing service offering support to veterans and their families. It's very important that these veteran services are both sustainable and fully embedded within the mainstream of the NHS, so that veterans can move to other mental health services if necessary and at the right time. I think, in view of what colleagues have said, let me conclude by returning to my original point. I think there are services in place. They've clearly improved. We've recognised the good work of my honourable friend, the member for South West Wiltshire, some time ago. We've recognised the demand that has come back. But it's plain from what colleagues are saying that you want us to do more and look for more. I don't think there is a finite limit that we can go beyond in recognition of what has been done for us. I'm absolutely certain the commitment the Prime Minister made in his answer to the Honourable Lady this afternoon, where he demonstrated his own deep awareness of these situations, is one that I know we can all rely on to continue to meet the commitments of the Armed Forces Covenant and continue to work closely with all those relevant organisations in the best interest of veterans and their mental health as the best way in which we can say thank you.
House do now